Good day, everyone. I am Sherilyn Francis, and on behalf of the Morehouse School of Medicine Prevention Research Center, we welcome you to part one of our Family Strong Family Meeting virtual series. Additionally, we invite you to connect with us via social media using the hashtag FAMSTRONG2020. I now present to you part one of our Family Strong series, presented by Dr. Tabia Akintobi and Mr. LaShawn Hoffman. And we will now have Dr. Akintobi, who will provide an overview of the Family Meeting virtual series.
Thank you so much, Sherilyn, and welcome everyone. Glad you can join us for our kickoff of FAMSTRONG 2020. So we are wanting to call a family meeting, and I want to certainly shout out Dr. Arletha Williams Livingston, who really conceptualized this idea and event. So all of us know we are in a new day and a new time. Thanks to COVID-19, we are having to be physically distant. We are actually having to look inward, not just at our own health risk, but also that of our family. And when we say family, we don't just mean those that are related to us by blood, but those that are connected to us via social ties and social connection. We're being told daily, particularly in communities of color, that because of cardiovascular disease or diabetes, that we are at risk. We're hearing terms like health disparities. And for some of us, for the first time, communities are hearing the terms health inequity. So how can we change these burdens or this perceived negative slant to something positive? And that really is what FAMSTRONG 20 is all about. We know that we are a people of resilience, that we are able to develop the tools and the resources to bounce back stronger than before. And through FAMSTRONG 2020, we want to inform you, we want to encourage you, and we also want to create some positive peer pressure such that you take this FAMSTRONG 20 experience as one that encourages you to participate. And you'll hear a little bit later about the friendly competition that we're trying to develop. So through talking about not just COVID-19, but also issues related to social justice, which is another pandemic that we're in the midst of, we want to give you the tools to understand the past, to be able to confront our present, and also to advocate and educate those under our roofs and those that we care about towards being stronger than we ever were before. So we're very excited about how this experience aligns well with the Prevention Research Center, and that is to bring together three important things. First and foremost, communities should be at the forefront of creating any type of program or intervention. So this is not designed to just have discussions with clinicians or those who are researchers, but it's designed to bring together community leadership and thought, as well as other expert advice on how we can live our best lives. I am so very thrilled to be working with my partner in good, Mr. LaShawn Hoffman, who is chair of our Community Majority Board. And this really is a model of what we hope to encourage and really facilitate through FAMSTRONG, the importance of community leadership, as well as academic support and advice towards living our best lives. So I'm really pleased to turn this over to LaShawn Hoffman, and as we do, we will certainly give you more information about FAMSTRONG 20 and really welcome you to this kickoff. LaShawn?
So I want to join Dr. Akintobi in welcoming all of you to FAMSTRONG 20. I'm really excited because I think this series can be fun and energetic, but informational and educational all at the same time. And so true to our form, it is important for us to make sure that situations such as we're experiencing in this pandemic and other health-related issues are shared in a format where everybody can get it, right? I think the importance of this series is think about when you're at the dinner table and you're having a discussion about what happened during the day, or you're watching the news and you're having to discuss something that may be happening on the news and you're trying to find out, well, is that true and how is that related to me and what does that mean for me and my family and in my community? This series has been designed to kind of answer some of those questions that you might be having, for you to present some of your questions for answers, and to bring kind of the overall community together so that we're on one accord as we're moving forward towards health equity, because everybody wants to be well. Nobody wants to be sick. I'm excited simply because I think this is also an opportunity to really highlight not only our clinicians, but our community experts in this series, right? And there's a bunch of great people doing great work across this country. And I said across the country and not just in Atlanta, just because this series isn't just for Atlanta or just for Georgia. Right. This series is for everyone. And so we want to make sure that people across the country are highlighted in this series that we're piloting today, and that this is an exciting time to be a part of our community. So if you haven't invited your family, invite your family so they can be ready for the next family meeting. We're having our family meeting today so that we can launch you on this successful journey that we're taking around FAMSTRONG 20.
This is really wonderful, LaShawn, and I think we are learning together, right? So these series are going to feature different topics all the way up through October of this year. So you can see yourself and find yourself in terms of topics that are important to you every Saturday at 5 o'clock Eastern Standard Time. And I think we are open to being flexible and adjusting the agenda. If we get new information, we certainly want to use it. So please advise us in the chat. If there are things that come to your mind as we have this family meeting, think of us as being around the table. So whatever you want to share, questions, things even that you've heard this week that you might want to share and reflect on, please use the chat as we continue to have this family meeting. The first thing that we did in kicking this off in the month of May, the first one was focused on mental and behavioral health. And my goodness, it was an amazing topic. It coincided with Mental Health Awareness Month, and we were planning this well before COVID-19 hit. But we all know that when things like a public health pandemic happen, they really bubble to the surface, those things that were already lying underneath. That was an amazing event. We had about 250 registrants, and as you shared, LaShawn, they were certainly not just from Atlanta, where the PRC is based, but they were from across the nation. So we know that while we are physically distanced, we really learned that people are hungry for connection. I think you might agree with me, LaShawn, that people felt connected and certainly felt that they could share during that event.
You're absolutely correct. And I think the awesome part about that was that many people were participating via the chat and through submitting questions. And again, I just want to encourage all the people that are attending this family meeting that this can be only as beneficial as you want it to be. So the more you provide, the more questions you ask, the better that our family meetings can be, right? And so here's why this is really important. I've just been thinking about family meetings that didn't happen in my family, right, around health-related issues that I think I would have been so much more prepared for in my adult life if we would have had some of these tough conversations. I'm thinking about, it wasn't until I realized my grandmother was very sick and in the hospital that someone decided to share with me she had cancer and how cancer was discovered. And I think I could have been better prepared, and to prepare not only my siblings and my cousins for this transition. And where I must say that my grandmother did a phenomenal job as a woman in making this transition and helping us as she was transitioning. That was a conversation I would have rather had with her sooner than later. And so I know sometimes it's difficult to have conversations as it relates to health. I'm also thinking about a conversation that I recently had with my mother and my mother around breast cancer and just trying to figure that out and realizing that my mother didn't discuss having breast cancer because she didn't want us to think that what was happening what happened to our grandmother was going to happen to her. And I said to her, you got 3 boys. We've got to be able to understand what this means. And some of my brothers have daughters. They need to be able to have these conversations too. So we want to make sure that these conversations and these topics that we're having help you to have the conversations within your households to dispel not only the myths, but the fear around what's happening, and allow everybody to think about how do we then improve our quality of health and have a better life.
This is really important because I think, now more than ever, these conversations are so important because as I think about even some things that communities of color and those within our households deal with regularly are things like diabetes, and this is in my family, cardiovascular health or high blood pressure or sugar, all the ways that we coin it or call it. And those things were always there. But now with COVID-19, we're more sensitive and aware of our health risk. And I think one of the questions, to your point, LaShawn, that has come up and that we've discussed is how do you have those tough conversations? I think people are more interested and attuned to having them because of the space that we're in right now. Sometimes it takes just reflecting on the loss of a loved one and saying, when we think about that family member or the person that we cared about, what are some things that we want to try and do to prevent or at least find out what our risk factors are so that as a family, we can try and focus on prevention, which again is one of the words in the Prevention Research Center. How do we dial down that risk, right? So I know through FAMSTRONG, we know that some of the risk factors related to things like diabetes and cardiovascular health or high blood pressure are just going out and getting moving. I had to push myself this morning to get moving. And I think, LaShawn, we spoke about you earlier this week. I got up super early, and best believe I did not feel like going for that walk/run, but I knew that I needed to model that for my children who are seeing me now more than ever because we're all at the house. So even as we can encourage each other to do those things that we may not like to do in the short term, but we know that for our families to be strong, we need to make them a part of that, our lives, and model that well. So we're going to talk about that, and I think we're actually going to be doing some of that. I know Sherilyn will give us some hints, but there are going to be some interactive challenges besides just talking that will help to make FAMSTRONG super fun.
So I'll end with this because I know we have some questions that'll come up. I just think as a Black man myself who have been diagnosed with diabetes and deal with that on a daily basis, I really at first was shamed when my diagnosis came back because I thought I did something wrong. And I kept trying to figure out how do I then change the situation so I no longer have diabetes. And so where my diabetes has made me a bit more insulin dependent, and I know that there's a lot of information out there regarding all of that. What I did not realize was my father, each one of his siblings, my grandmother, and there was this whole lineage of people that had suffered from diabetes that no one had said anything about. So my diagnosis made me have a conversation with my father. So when I was diagnosed, that's when I learned my father actually was a diabetic. Wow. And then when my father told me that, he was like, yeah, and your uncle is, and your aunt is. And I was like, well, why haven't we had this conversation?
Yeah.
So I'm having the conversations with cousins and everyone else because I need them to dispel this myth and then figure out how do we have a healthier conversation and healthier relationship with food, because food is so important. I love food. I live for food. Food is who I am, in a manner that allows me to continue to have a better quality of life. And so kind of managing kind of chronic diseases, kind of thinking through how do we have our mental health, and what are all these social determinants of health are part of this series, and why we're excited about kicking off FAMSTRONG 20 today.
And just as a reminder for everyone, in the midst of all the ways we want to dial down risk so we can live our best, most productive lives, we would be remiss if we didn't share a few things that we've all heard, but just as a reminder, the simple things that we can do whether in our houses or in the public. Make sure you have a face covering. So it does not have to be an official mask. It can be something that just covers your nose all the way through the bottom of your face to help to decrease your risk of exposure. Stay 6 feet apart. Even if there are no symbols or blue tape on the floor where you're going, make sure that you do that. And then certainly washing your hands. And when you don't have that, using hand sanitizer. There are a lot of things that we need to do in terms of our behaviors and thoughts surrounding what even healthy means. But at this time of COVID-19 risk, I want to remind you of those things. And then also mind, your mental and behavioral health. And that is complicated when we think about it and say it, because it's not a just. But there are some things that don't cost anything, like going outside, taking and getting fresh air, that vitamin D that most of us don't get enough of. Just looking out the window or going outside is important. And moving, you don't need a sidewalk, you don't need a gym. If you have a phone, you can turn on some music that sometimes can bring out good memories and move, right? So all of these things are some of the simple things that we want to promote, and we certainly will be digging in as we continue with FAMSTRONG 20. Sherilyn?
So here's one of my favorite masks, Dr. Akintobi.
Yes, I can't see all the detail. Okay.
My Star Wars one.
I'm gonna make sure I bring mine the next time so we can compare notes. There are some very beautiful ones out there, some of them with very important messages to boot. Thanks. Sherilyn?
Absolutely. So this is the interactive question and discussion section of our family meeting. So we want you to turn on your cameras, turn on your microphones. We do have some questions that you've submitted during registration, but you are free to ask questions and to generate some dialogues or even to generate topics that you are interested in learning about in the future. So I'm going to steal a term that Dr. Akintobi coined about 30 minutes ago. So my question as a non-man, I want to know, I would like to know, how do we non-men engage the men in our community around health? And how do we point our men to resources that are specific for men? The men only club and space in healthcare, because we know that oftentimes African American men are less likely to receive preventative screening, and they are also less likely to receive primary care services, and they are oftentimes diagnosed later for many chronic conditions. So how do we non-men encourage and empower our men? And Mr. Hoffman, I'm going to ask you as a man, what is your charge to the fellow men?
So I think I would first start by saying is that we have to listen more and listen to those loved ones when they're sharing information with us. And I think what has to happen is we have to have a lot more conversation and asking those questions. I think for me, when I was trying to get my dad to open up, I had to do it in kind of incremental setting. So it was, tell me something about, I think I started with, tell me something about my grandmother, then tell me about this. And then I would kind of slide in kind of a health question and getting my dad to kind of respond back to information that I might need. And later, I start asking, are you doing this? Or have you heard about this? And so I think it's about that interaction, but I would encourage you to continue to keep having the conversation with men and pointing them towards those resources. I think the other piece around this is I don't think you can sugarcoat it, right? Sometimes you got to have those hard conversations. And so, as I shared with you, when I was first diagnosed with diabetes and was having the conversation with my father, I don't think he understood how important it was to have this kind of conversation about how genetics play a part of what we were both kind of dealing with. And it was later after we kept having a couple of series of conversations that I think that it clicked for him and that he started to pay more attention to his own health. And that we didn't wait until someone else was tragically ill before we started to have that conversation. So I think it's about how do we continue to engage them, and I think instances like this, that these 30-minute sessions that we're going to be having will allow men to be more comfortable in sharing and having conversations about health issues.
Mm-hmm. I see Jerome just said include men in the planning phase, and I know we have a couple great examples of how we've done that, and LaShawn's leadership in collaboration with the Prevention Research Center has done that. We can certainly share that with folks in another space. But, what we find and what I found personally, but also through the Prevention Research Center, the reason why people engage oftentimes has nothing to do with the topic, right? So if the topic is oral health, or if the topic is cancer, the reason why people engage and stay engaged is not necessarily because of that particular health issue. It's because they have an outlet and a safe space to be able to share and engage. And we know for men, all men I would dare say, but particularly men of color, society and sometimes even their family has not created a safe space for them to be vulnerable, right? And then also I found even in my own family, I really had to finesse the conversation with my own father. I realized that saying, did you go to the doctor, or why didn't you go to the doctor, is not the way to go. So, the discussion has to be sometimes around something that's gone on in the media. And again, thankfully with COVID-19, people are more aware of their health. They're hearing about how things like COVID are, not about just dying earlier, but maybe 20 years from now, but their health status could mean imminent death or being in the hospital because it's connected to something bigger. So this time and unique space that we're in is an opportunity for the men in my life who are not as health conscious, for me to have those conversations with them and position it from a place of how much I need them, right? I need you to be around. We care about you, but we need you. And I think for most men, the responsibility of being needed, for people depending on them, is something that resonates more than, why they didn't go or did go to the doctor. So really thinking about and reflecting on other issues that we can actually talk about now, because they're hearing not just about it from me, but through the news, but also how much we need them to be here, not just for us, but for their grandchildren, for their nieces and nephews. This is just a prime opportunity, and I hate to say that this pandemic has been the opportunity for that, but I really think it has.
Thank you both so much for extremely insightful answers, and from both of your perspectives as a man and as a non-man. So thank you for sharing those perspectives. So we have another question. So the question is, how do we initiate the conversation around starting a family medical history? We know that that is so important. And Mr. Hoffman, you touched on the importance of knowing your family medical history. So for those of us, how do we start that? Regardless of the age or where we are, but how do we engage our elders and also our brothers and sisters and cousins who are of similar ages around the importance of starting a family history, a family medical history, and even initiating that process and documenting it properly?
So I actually just did this with my dad. They live in Florida, and Florida is a hot spot right now, but we realized that for many reasons, they needed to see, my dad needed to see my face, even though it was masked for most of the time, to be reminded that he needed to wear his face covering, but to also remember those people who needed and continue to need him. But the conversation really was just about, how much he knew about different aunts, uncles, and siblings. It was not even a discussion about health. But also we started to discuss what are some of the reasons why they passed or what illnesses they might have had. So it was from a position of tell me the story, right? Again, not starting with the health history story, but tell me the story. And it turns out that my aunt, who usually is a connector across all of us, she has done that family tree, not family health history, but kind of knowing, by generations and name where they ended up, how they passed away, how many children that they had, etc. So it started from a place of family first, and those conversations where, again, through finesse, I'm weaving in a bit more about some of the health conditions that they've had. I have a lot of cancer in my family. And so besides really navigating the risk factors related to that, which is my interest, it was about having the conversations of tell me what I don't know, right? So I'm here to be educated and to understand. And for my dad, that's always a great position to start with because he wants to share what he knows. So,
Yeah, I agree with you. I think, Tabby, I think it's important because we have such a rich history, right? A rich oral history, and sharing those stories lead to those conversations. And I think it's about how do you embrace what we already know, what we already have, our own legacy, and that's that rich oral history, and start from there. I started my own family tree and started something very similar with other family members.
That is wonderful. Thank you. And I want to encourage all the participants, if you have any questions, please feel free to submit them in the chat box. We do have a question specific to COVID-19. So recognizing that we are in the era of COVID-19 and information is coming to us faster than we can absorb it, how do we work to counteract misinformation about the coronavirus?
yes, that's a really great one. One of my colleagues recently used the term that besides the global pandemic that we're in and the social injustice epidemic that we're in the midst of, we're also in the midst of an infodemic, meaning information overload, whether it's social media, the media, all types of information. And it is tough, even for us who know a bit in terms of public health, to really distill what is truth from fact. And then we also layer on that the political realities of differing advice that are coming, both locally and from the White House. And so it's important to have a credible sources. So certainly first, Morehouse School of Medicine, whether you are in Atlanta or somewhere else across the nation, there is a source that through www.msm.edu that will point you to shortly. But there actually is a Mythbusters site, and I will share where you can go to that. So first, all credible information as a point of reference that you can go to is www.coronavirus.gov. And so at that place, you'll find a number of resources from CDC, which is among the credible sources, from the World Health Organization or the WHO, and then from FEMA. And so at that space is a clearinghouse of myths, facts, and also a place where you can go to find out what is true and what is not. And they are regularly updating that source of information. But I want to give a shameless plug. On next week's Saturday at 5 o'clock, we will delve deeper into COVID-19 myths and facts that certainly regularly need to be dispelled. So in addition to learning about media literacy, which of course is big when we think about all this information overload, also during next week, Saturday, you'll hear about some specific clinical facts related to COVID-19, but hopefully that's a great resource for everyone. And I'll also type it in the chat so that you can copy it or save it.
And I'm just going to reiterate what Jerome in the chat just simply said: consider the source, make sure that it's credible. And so minimize where you're getting your information from to the ones that you consider to be credible. And so Tabia just shared some with you, but again, make sure it's a reliable and credible source.
Thank
And
you
attend
both.
next Sunday. I mean, next
Yep.
Saturday.
Yes.
Next Saturday, 5 p.m. Eastern Standard
Yeah.
Time.
Yes, and Mr. Alonzo, we want to encourage you to invite all those people that you are now going to use the new term infodemic with. Please invite them to next week's session, where, as Dr. Akintobi mentioned, the session will be focused on COVID, dispelling myths and media literacy around COVID-19. Thank you. Okay, so that is actually our time. So 30 minutes goes by so quickly. So I'm going to ask Mr. Hoffman and Dr. Akintobi, can you please close us out, as in give us your charge for us for this week?
Well, I'll let LaShawn close us out, so I'll go right before him. And I think we'll talk for a minute or so about what people can expect in terms of FAMSTRONG 20 and this friendly competition. Stay tuned. You will learn, you will be encouraged, and you will participate with the culmination in October of some great prizes based on your investment in yourself and your family, whether by blood or by social ties. This is the space for us to think of resilience. What is on the other side of this COVID-19 pandemic? And that is living our best lives based on education, being based on engagement, as well as participation. So please stay tuned. We will be here every Saturday at 5 p.m. Eastern Standard Time.
So quickly, I'm going to say, join me in inviting others. And one of the things that I'm doing, not only just inviting my family, but my friends that are family, we're having a virtual live party that we're going to start. So join me. I bet you can't beat me in inviting how many friends we can have to next week's call. So that's the charge. You know, I'm going to beat all of you guys in inviting folks here next week. So see if you can beat me.
Yeah.
I love it. I love it. So I am going to ask everyone within the sound of my voice, find the Morehouse School of Medicine, PRC, on your favorite social media platform. If you're on Facebook, all you have to do is search Morehouse PRC or MSM PRC. If you are on Twitter or on Instagram, all you have to do is use the little magnifying glass icon and search MSM_PRC. So find the Morehouse School of Medicine Prevention Research Center on your favorite social media platform and follow us. And when you follow us, all we're going to ask you to do for this week is just post some insights using hashtag FAMSTRONG20. So this closes out our session for this Saturday. However, we will be here, same time, same place, on August 1st. And again, we will focus on dispelling myths and media literacy centered around COVID-19. So to our highly esteemed panelists, Dr. Tabia Akintobi and Mr. Hoffman, we thank you so much for an extremely engaging discussion this afternoon. And to each of our guests, thank you so very much for attending. Mr. Arnold, Mr. Jerome, thank you for being so heavily engaged. And please encourage and invite all the men and all the family members that you know. And also to all of the attendees for today, we thank you so much, and we hope that you have a wonderful evening.